Yeah.
Hi, I'm Dr. Mary Evangiline from Vasan Eye Care, Trichy. Today, Dr. Shibu Varkey and me will be discussing the various facilities available at Vasan Eye Care, Trichy. I hope this interactive session will be useful to all of you.
Glaucoma is called as a silent killer because in glaucoma it is the peripheral or the side vision which is affected. To give as an example, if someone has a problem in his vision which is straight or central, then immediately he is able to understand that he has a problem. But if the vision is lost only on the sides or on the periphery, then it takes a long time before the vision becomes considerably reduced by the time the patient is aware that he has lost his vision. So that is why it is called as a silent killer of vision. And so since it is a silent killer, the patients need to be screened for glaucoma. Because it's a peripheral vision that is lost, there has to be a lot of uh, uh, degree of loss before the patient actually realizes that there's a problem. And that's why we need the patients to be screened for their glaucoma.
What screening tests do we generally do?
The most important screening test is to check for the peripheral visual field. Because unless the peripheral visual field is checked, we cannot know whether the patient has got glaucoma field defect or not. Of course, the other things that is done for glaucoma is the intraocular pressure, the pressure of the eye. And then nowadays we have the advanced technologies like the ocular coherence tomography, OCT, whereby the optic nerve and the nerve fibers of the patients can be studied. But then the most important point in glaucoma is that the patients need to be screened, because unless the peripheral vision is screened, we cannot be confirmed that whether there is glaucoma or not.
Can patients have simultaneous cataract and glaucoma? Will they be confused with their vision?
Yeah, it's very common to have cataract and glaucoma, because glaucoma, again, as you know, it's a disease which affects from middle age upwards. So it is possible that patients can have some amount of cataract along with the glaucoma. And at the time of doing a glaucoma surgery, it's very possible to combine a glaucoma surgery with a cataract surgery, so that in a single sitting we can take care of both cataract and glaucoma. Uh, in the case of glaucoma, controlling the eye pressure, that's the most important aspect, for which there are so many medicines, eye medications which are available. And once the patient is screened and confirmed to have glaucoma, then generally the eye medications are started, and then the control of the eye pressure is assessed by putting these drops. The other modalities which are available for glaucoma are laser surgery and also surgical procedures like trabeculectomy, etc. And also various implants and valves are available for the control of glaucoma. But the bottom line is, glaucoma is a controllable disease, and once it is controlled, unnecessary or needless vision loss can be prevented. So it's absolutely mandatory that people be screened. Everyone above the age of 40 should be screened. Everyone with a family history of glaucoma should be screened for the presence of glaucoma in their eyes.
What is your experience with shunt devices compared to conventional surgeries?
The glaucoma shunt procedures, there are various types of shunts. Some of the shunts, like the Ahmed glaucoma valve, it is used in certain types of glaucomas. It is not for the normal open angle glaucoma. But there are certain other valves which are available nowadays for the regular open angle glaucomas. So nowadays we have the express shunt, which is available for doing in open angle glaucomas, and it adds on to the results of trabeculectomy and ensures that the results are sustained over a long time. There is no failure of the surgery. So definitely this is a very controlled drainage, and a long-term stability can be got by using the express shunt. It is very difficult to handle end stage glaucoma because they have a high risk that during surgery whatever vision they have, that can also get lost, that can also be lost. So it is not it is a very risky situation. If the pressure can be controlled even at that point by using eye drops, that would be the best option. But in certain selected cases, we can also offer for surgical approaches. So the most important message that we want to convey about glaucoma is that it is a cause of preventable and needless blindness, and people who are at risk of glaucoma, like people with family history of glaucoma, people with diabetes, people with blood pressure, people with cholesterol and other such triglyceride problems, people with thyroid diseases, people with anemia, such kind of people definitely needs to be screened for glaucoma. Just by doing a simple intraocular pressure and visual field analysis, glaucoma can be confirmed. Just by using few eye drops, the glaucoma can be kept well under control.
Hope you had a good interactive time with Dr. Shibu Varkey. You can subscribe to us and contact our customer care for further details.